spend a little bit of time contextualizing this study within what Zane just spoke about. So my study is about religious community support and the impact that having or not having religious community support has on women in particular when they're facing discrimination. And so the study that I'm presenting for the lecture today is really just a snapshot of my dissertation research. So just to give a quick overview, I'll start with a kind of just broad picture of Muslims in the US to provide a little bit of context of who exactly we're talking about. I'll talk a little bit about some of the theories that are guiding the work, talk about discrimination in particular, and some of the research around those areas. I'll go through my method quickly, and then we'll go over the results and implications and saving questions for that. So just some fun facts, and some of you might already know this, but 1 in 10 incoming immigrants to the United States is Muslim. So Islam is growing in the United States, and we need to start taking more nuanced views of things. Islam is also the second most commonly practiced religion in 20 states. So these are the states with little stars, are the stars where are the states where Islam is the second most common religion. And as we all know from this conference, Muslim Americans are ethnically diverse. This is a breakdown of what the population looks like. And the reason why I'm showing this slide is because the research doesn't look like this. And so for all of you that are familiar with the research, who are the two populations that are most represented in the research on Muslims? Arabs and South Asians, exactly. But look at African American Muslims. They are a full third of the population, and we don't focus enough on them. And so what I did for my dissertation was I tried to figure out why. And I also tried to make sure that that population was included and that those voices were part of this. So 2 research questions guided this part of my dissertation. The first one was, does religious community support mediate the relationship between perceived discrimination and depressive symptoms? And so that's a lot of statistical jargon, so I'm not going to focus too much on that. But what I'm asking here is, when somebody is experiencing discrimination, does their lack of support or support of their community enable the depressive symptoms or inhibit the depressive symptoms? So that's my question. And when you asked about mediation, it's asking if religious support is kind of like a bridge between these two experiences. And then my second research question was, what within group differences between men and women in particular exist in the relationship between religious community support, perceived discrimination, and depressive symptoms? So I want to spend a little bit of time before I get into my study talking about the mental health implications of experiencing discrimination. So we all know that when discrimination happens, it can leave us feeling helpless, it can leave us feeling hopeless. A lot of the symptoms of depression map on really well to folks' response to discrimination. People respond in different ways, but depression is one of the ways that comes up. How does that happen? Well, through poor self-esteem. So if you're continuously being told you don't belong here, you don't belong here, you don't belong here, how many of you have felt in your graduate programs or in your spaces that you work in that you don't belong? I sure have. And that leads to self-doubt, self-criticism, poor self-esteem, which is one of the main symptoms of depression. Isolating oneself. So the research shows us that within the Muslim community in particular, when they're, especially after 9/11, some people flocked to their communities, but some people avoided the communities for safety reasons. That if this community is going to be attacked, I want to stay at home. A lot of narratives from my research that have come out of Muslim women who wore the hijab before 9/11 and took it off after over family pressure to take it off. Because the parents want to keep their children safe, understandably. And then again, these feelings of hopelessness and helplessness that just come, it's a systemic structural problem, what can I do about it? That leads to those feelings as well. So the fun thing about giving this presentation here, because I presented this at a few different places, is that my whole audience almost is Muslim. So I wanted to speak a little bit about how the stereotypes of Muslim men and Muslim women are different. So the top picture is a Google image search when I just searched Muslim men. Those are the images that popped up, and then the bottom image is Muslim women. So I like to use Google for these things just to kind of show people that this is what pops up when you search us, right? So for the Muslim men in the room, what are some stereotypes that you've experienced? What do people say about Muslim men? Come on, energy, come on. I know this is the last presentation, but
We're all Arab.
we're all Arab, yeah, and so look at that. Like, those are all Arab. I think there's like maybe one black person, a few South Asians. So what are some other stereotypes that Muslim men face?
That you oppress women.
That you oppress women. So these questions of being a terrorist, being violent, aggressive, these sorts of things, right? And now on the flip side, Muslim women in the room, what are some stereotypes that you've experienced? Yeah.
Muslim women are seen as oppressed.
Muslim women are oppressed.
That we don't have a voice.
Muslim women don't have a voice.
You don't speak English.
Muslim women don't speak English. I was born here. What do you mean? Right? So you see that the discrimination that is felt by men is different than the discrimination that's felt by women. And we experience different types of discrimination based off of our identities. So I want to talk about the construct of religious community support. So this was a variable that I used in my dissertation, and it was actually developed using a Muslim sample. So essentially, religious community support, when I talk about it, I'm talking about the perception of support from one's religious leaders, members of one's religious congregation, and God. Religious community support has been shown to be associated with increased life satisfaction and lower levels of depression. So we expect that when people have support from their communities, that they feel less depressed, less isolated, and so on and so forth. Religious community support can also create an increased sense of belonging and acceptance when the mainstream society is not accepting you. So to have a place that you can call home is very important. And so that's why this variable is really the center of this presentation. So without getting too much into the statistics of this, essentially, I'm just gonna go off mic for a second. So perceived discrimination should lead to more depressive symptoms. So the more discrimination you experience, the more depressed you are. That's why the little plus sign is there. Perceived discrimination might, I hypothesize that it would lead to less religious community support, that perhaps if you're being discriminated against, you might isolate yourself from your community more, okay? And that religious community support will be associated with less depressive symptoms. So the more religious community support you have, the less depressed you'll be. So that's what the model is. And I used a lot of fancy math that I'll try to explain as best as I can of how I analyze the data. So who was the sample? I had 166 Muslim women and 103 Muslim men. My sample was equally divided between South Asian, Arab, and African American Muslims. Participants all considered themselves to be very religious when I asked them a question of religiosity. And a quarter of the participants were first-generation immigrants, and the remainder were second or third generation. So first generation is they were born in another country. Second generation is both of their parents were born in another country, but they were born here. And then third is both of their parents and themselves were born in the US. So this was my model. So I'll summarize it by saying that my hypothesized relationships were correct. That the relationships that I predicted were what they should be. But what I didn't predict is that community support only came up as a partial mediator. So it was only partially true that if you had more community support, you would have less depression. So I had to then run some analyses, some statistical analyses to get a sense of why this happened. So exactly what caused this hypothesis to not be true. And so what I ended up doing was I ran some analyses to take a look at gender differences, because gender was coming up as a variable that I need to look at more when I started to run the statistics. And so what I found was that women report higher levels of depression than men. That's not entirely surprising because that's consistent in the literature with all populations. But what I noticed in addition to that was that women, so this, oops, how do we go back? Yeah, okay. So this RLS is religious leader support. why it didn't come up as a mediator. And so then I ran some additional analyses to kind of just dig a little bit more and see, well, what exactly is going on here. So I compared women who wear hijab to women who don't wear hijab, because even when I based it on gender lines, it still wasn't mediating. And so I was like, okay, so there's something else. So it was actually wearing a hijab versus not wearing a hijab. And so I found that Muslim women who wear hijab report higher levels of support from their religious leaders. They report higher levels of support from God, and they report higher levels of support from members of the congregation. So this is women who don't wear hijab, and they're split pretty equally, both groups. And all of these were statistically significant findings. So this is why it wasn't a mediator. So essentially what's happening is that women are not feeling supported by their congregations or their leaders. And then women who wear hijab are doubly affected by that, because not only are they not supported, but they're even less supported than the women who do wear hijab. So I want to spend most of my time talking about clinical implications, advocacy implications, research, and so on. So I'm going to shift gears to that. So as far as clinical implications go, how many of you are clinicians in the room? Okay. So I think this goes for us too, and I think we've probably all had a moment where we've worked with a client who shared some identity with us, and that we assumed maybe more similarity than there was. That was my first Arab client that I had. I really botched that therapy. So I think one of the things that's really important is that we conduct thorough psychosocial histories, including religious identity and how the person's religious identity developed. What types of religious coping does this person use, and what types of community supports do they have? Because we know community support can be powerful. We know it can kind of buffer the effects of discrimination a little bit. We also want to directly, as clinicians, directly engage in self-exploration on our own identities to give us a sense of how our perspectives may be different from those of the folks that we're working with, even if we share a lot of identities in common. Another clinical implication, any clinicians working near or on college campuses? Yeah. So trying to conduct outreach activities at universities and community centers with other health professionals in Muslim spaces. So if you're a clinician, join up with some other health professionals and do a depression screening at a mosque. These sorts of things are counted as kind of outreach activities. They're covered under your insurance and things like that. As long as you provide adequate referrals and everything, you should be able to do stuff like this. And this is the stuff that we should be doing as clinicians. So advocacy implications. And when I say advocacy, I'm really leaning heavily on what Dr. Munaimer talked about during her presentation. She said at the end, advocate, advocate, advocate. So engage in advocacy efforts to reduce discrimination targeting Muslims in whichever way makes sense for you. So whichever way that you can get involved, get involved. Anything is better than nothing. I was reading an article a couple of days ago about a woman who spent her whole adult life feeding the civil rights movement, literally cooking for them. And she's just as much of an activist as Martin Luther King. She's just as much of an activist as anyone else. So find your way and do what you're good at. Educate others on the mental health impact of discrimination within group and outside of group discrimination. And then also, I think, publicly discuss the detrimental effects of programs that equate Muslims with terrorism. So countering violent extremism, these programs are hurting our communities, and we need to not be engaged in them. These are the programs that are keeping people out of the mosques. Increase opportunities for Muslims to engage in their religious communities, so for all Muslims. How many of you go to mosques that are predominantly one ethnic group? That needs to change. We need to make, because I come from an Arab background, and the mosque that my family goes to, all of the khutbahs are in Arabic, everything is in Arabic, and immigrant communities do need stuff in their own languages, but anytime you can have an interpreter, anytime that you can make a space inclusive for everybody, that's something that's important. So that's something that we should advocate for. And also just supporting efforts to give Muslims voice in research, professional practice, and other areas. So anytime that you can hand the mic over, hand it over. As far as research implications go, engaging in research that further explores nuances in Muslim women's experience too much of the research portrays us as a monolithic group. We need to start thinking about, you know, is it actually true that, I mean, that's one of the things that surprised me about this research is that we've been saying that discrimination affects women who are visibly Muslim more than women who don't have any visible identifiers of their faith. And my results are kind of complicating that a little bit. And so we need to do more research, and a more qualitative and quantitative research to get a sense of what's actually going on. We also want to challenge conceptions that we're just all Arab or that we're all one thing, and move beyond that narrative. We also want to directly engage Muslim women who choose not to veil in our research, hear from them, what are their experiences, and develop evidence-based conclusions regarding Muslims rather than relying on personal experiences or anecdotes and things like that. We really need our conclusions to be research-driven. And then finally, I want to speak a little bit about faith community implications. Anyone is a faith leader here? Okay, so tell your faith leaders I said this. We need to intentionally recruit women for leadership roles within religious community organizations. There needs to be somebody, and I understand culturally the gender segregation types of things that happen, and that's fine as long as there is a leader for the women to go to. Funding and supporting women's organizations within religious community organizations. So much I see, at least in my community in Chicago, the men's events are held at these fancy banquet halls, they're super nice, and that the women's events are held in the mosque basement. Does anyone have that in their mosques as well? So we need to be allocating equal resources to men and women. Has anyone seen Hind Mackey's side door project? Yeah, she takes pictures of prayer spaces that women use in various mosques and what they look like. And so that's, you know, improving women's spaces within mosques is really important. The mosque that I grew up in, MCC in Chicago, they just redid this beautiful balcony for the women's section, and all of us were thrilled to see it. So, you know, these things are things that we need to be doing. And then also, I think for the faith community to be inclusive of women who choose not to veil. It is a choice, and it's a choice between a woman and God, and that we need to support women regardless of their level. I mean, our khutbah today really highlighted this point, that we need to meet people where they're at faith-wise, and that they're still our family. And we're excited. And I quickly, in my last minute, just wanted to say that this is my first time presenting at the conference, but I've been helping with organizing it for 4 years now. And I wouldn't have been able to finish my dissertation without these folks up here. Dr. Lamise was on my committee. Halim helped so much. Camila helped so much. Muhammad, Farah, Hamada, everybody was so helpful. And so I just wanted to shout them out real quick. And that's it. Thank you.
So then we have shot the Sudra, we stayed on the Rahu, Didin, Rafko, I just want to say, Assalamu alaikum warahmatullahi wabarakatuh. How people still here? I know this is I'm the last speaker in the second day. And I want to start by saying I'm super excited to be here, honored to be a part of the people presenting here. And this has been kind of like our rock star convention for me. These are people who I've quoted in my thesis and this research, and actually one of the people in my slides is Dr. Amer, who I didn't expect to be here and was really excited to see her. So, you know, alhamdulillah, so grateful to be a part of this. My presentation does not actually follow the topic of domestic violence. Not totally sure why I was included in this panel, but that's okay. I had to fit me in somewhere. I'm not going to fit in somewhere. I would like to say my presentation, this is my thesis research from Cal State East Bay. I graduated in 2017 with my MSW, and my interest is really a social work perspective, which is strength-based and wellness-oriented, and wanted to, in my thesis, portray why Islam is good for women. There's so much in the media, and I really liked what was said about how, you know, 10% of the research on domestic violence is on Muslims, and we're 1% of the population, and that's not a coincidence. And I know we have a serious issue, as many communities do, there's domestic violence, but also what was said about the reason Islamophobia and how that affects our mental health needs. A lot of that has to do with negative portrayals of Muslims in the media, and the reason for my research was in part to create a context for more culturally competent health and social services, so that clinicians, when they go to research and they know nothing about Islam and they Google Muslim women, get not domestic violence, not Islamophobia, but how Islam is good for women. So that was the intention of the study, to talk about how Islam benefits women. The literature review I did basically just studied protective factors, religious spirituality as a protective factor. What was said about social support being a significant protective factor was definitely prevalent in the literature that I surveyed, and the literature was unclear about the second research question. So it was a community sample recruited through local masjids, emails and snowball samplings, 20 women total, 8 clinicians as key informants, 8 Muslim mental health clinicians as key informants, and 12 women in focus groups. The women were 18 to 65, Muslim convert or born in the United States, all college educated, mostly South Asian, but also North African, Latino, white, and Arab. It was a mixed method study. Key informants and focus groups were all given the Duke Religious Index and the Satisfaction with Life scale, and then participated in semi-structured interviews for 60 to 90 minutes. Data was collected through SPSS, interviews, the qualitative data was listened to once, a code book was made, and then data was analyzed. I primarily did the data analysis. So I'm going to just breeze through this, but the basic results of the quantitative study, portion of the study, was very inconclusive. It was a small sample size, and the scores from the participants were so high on religiosity and life satisfaction that it was really meaningless. There was no correlations found between any of the demographic data, religiosity, any of the variables. So the quantitative results were inconclusive. But the qualitative results were really interesting. This was intended to be an exploratory study, and when Dr. Emmer spoke, she talked about how we need to do more strength-based research. And while this still falls into the category of localized, non-probability samples, and doesn't solve that problem, it is strength-based research, which hopefully can contribute to more of that orientation in our research. But in terms of social support, the main positive themes were sense of belonging, strong values from community and family, connection to Muslim peers, guidance on how to behave with family and peers. I'm going to skip over this part and just go, since this has been mentioned so much, I think this might be one of the more interesting. I'm trying to rush through this because I want to have time for questions, and I don't want to take up too much time, but over the course of the conference, I've heard a lot of people talk about hijab, and one of the things that has really come out is that hijab is a protective factor. Dr. Zinnen's research showed that hijab is a protective factor. Your research showed that hijab is a protective factor. It was true in my research, 17 out of the 20 participants reported wearing hijab, and they unanimously reported that it contributed to social support. One of the things I want to say about hijab, though, is I think, and hopefully somewhere in literature this will be contributed. If this gets published, I've submitted it for publication, I don't know what else, but one of my participants said, sometimes she wears the hijab and sometimes she doesn't. And I love this quote because I think people tend to get a little bit OCD, and we have this conversation about how people can kind of OCD about religious requirements. And she talks about how sometimes she wears hijab and sometimes she doesn't. So she said she was in Costco and someone asked her, is someone forcing you to wear hijab? And asked her if she was okay. She said her response was, it's my wish. One day I'll go to Costco with a hijab. One day I will not go to Costco with my hijab. It's my preference how I feel on that day. It's different for me. Some people choose to wear it all the time, but I do it occasionally. I want to have the privilege of being whoever you want to be, and I don't want to be perceived as a stereotype. I want to be free. Wear it. That is my freedom. Don't wear it. That is also my freedom. And I found this is really powerful to me, that if we're going to talk about hijab being a protective factor and how women have the right and benefit from wearing hijab, we need to be careful not to be too uptight about how women wear hijab and just say, you know, you want to wear hijab? Great. You know, you don't want to wear hijab? Great. You want to wear hijab some days? Great. And I felt like that came back from my research that it is helpful and it's beneficial. I think that's one of the conference too. Two other themes that I looked into were self-esteem and emotional health. Again, the women unanimously reported that Islam support in their religion, spirituality support their self-esteem and their emotional health. One of the themes that came back was that people had a lot of self-worth. Another thing that I really loved from my research, and I know I'm on the hijab topic, and I kind of tried to avoid it because it's another thing that's kind of over prevalent in the research. You know, all this stuff about Muslim and hijab, and you know how important it's veiling. It really isn't, you know, that central to religion, and you know, there's a lot of things that are more important. But talking about how women talked about in the study how being visibly Muslim was really important to them, and that they had pride in their religion, and whether it's wearing a niqab or just being vocal about being Muslim, that they had pride in their religion, and that contributed to their self-esteem. And another thing that came out in large numbers, and I'm just picking out a few of the selective themes because I just thought they were interesting for this group and relevant in the research, but patience and adversity. The two secondary themes that came out, which I was not looking for, were Islamophobia and mental health. Islamophobia was mentioned by many women as taking away from their mental health, making it more difficult to be Muslim. And a lot of women talked about the need for more mental health resources in the community, that there was stigma attached to identifying as mentally ill, there was stigma attached to seeking therapy, and that they felt like their mental health would be better if there was a stronger, greater outreach to the community around mental health. And they suggest things like go in the community, do a slideshow, do a PowerPoint presentation on a family night, you know, have a family night where you present to the masjid about depression or stress. There's a little work being done right now by the Bari Muslim mental health professionals in this direction. And I know the Institute for Muslim Mental Health has PowerPoints and does a little bit of outreach. And there's a little bit of outreach going on, but really the women said they don't feel like they're getting anything in their communities. They're represented a variety of mosques in the Bay Area, which is a pretty active Muslim community. I continue to think this work is really critical and just starting to scratch the surface of where we need to go, and we need to really continue to work on reaching out to the community and increasing the average community member, that people who aren't involved in mental health get the word out there. So for the research questions, research question 1, yes, religious spirituality is a protective factor. Research question 2, basically, this is a very complex question of how religious spirituality benefits Muslim women. Lots of room for further research. Just encourage people to do strength-based research because there's a lot there. In terms of the implications, for individual practice, for us as clinicians, spiritual modified CBT, and you know, going back in Islamic history to al-Balkhi, and to other Muslim physicians in, I think, the 9th century, and I talk about them in my thesis. Spiritual modified CBT was an Islamic psychotherapy approach that was used by early Muslim physicians. So there's documents that talk about early Muslim physicians using spiritually modified CBT. They don't call it that, but we as clinicians are familiar with CBT, And there is information about spiritual modified CBT in the literature, and it's definitely supported by my research. These are definitely supported by my research. Also, Amr and Ahmed talk about Rogerian humanistic therapy and just the importance of the individual, how that's in line with a lot of the findings of the study, talking about people, the essential value of human being and our worth in God's eyes. In terms of social work education, how important it is to educate clinicians that Islam is a support and a benefit for people's mental health, and to increase the amount of awareness in social work curriculum. I'm a social worker, so that's my focus, but in curriculum, I think people are talking about, even places like Harvard, needing to work on cultural competence and focusing on having a positive view of Islam and how it helps us and how it helps women. Women are not, these oppressed, Muslim women are not oppressed by our religion, but we benefit from our religion. And again, future research, more research with larger samples, more localized. Obviously, my research doesn't fit that. Sensei and Baziam did a large study in the Bay Area, how really the research needs to go in that direction. And like I said, Dr. Armour talked about it too. I personally don't have the bandwidth to be able to do that kind of research, the access to the resource to do that kind of research, but I really would be excited to see people doing it, and people are starting to do it more. But in terms of organizational approaches for human services, really the importance of cultural competence, again, just keeping on track with cultural competence, and also that spiritual competence is trauma-informed. For us to do trauma-informed care as clinicians, and for us to support our coworkers, for those of us who work in social service organizations that are multi-faith and diverse or secular, to support spiritual competence in each other's work. And finally, continuing to talk about, again, Islam is good for people's mental health, and talking about the impact of stereotypes and Islamophobia on providers and organizations, and talking about how we can improve the perception of Islam in the community. Special thanks to the Muslim Mental Health Conference. Thank you so much to the organizers, and super honored to be included. Grateful also to the Cal State East Bay Social Work Department, Dr. Rose Wong, Center for Student Research, and Dr. Jen Yo, Center for Islamic Studies at the GTU, and Dr. Munir Jobo, and the Bay Area Muslim Mental Health Professionals. Thanks so much.